Good morning, ma'am. I'm Nisha Khandu, lecturer of BSc Nursing second year. Would like to give you a case presentation on the topic cholelithiasis. My patient name is Mr. Bir Bahadur Rai. He's 42 years old and he lives in Thatangchen, East Sikkim. He has not received any formal education. He is a farmer and he was admitted in multi-speciality hospital at 12 October 2019 at 2 p.m. With the chief complaint of radiating pain in the stomach, in the shoulder, and fever, nausea, vomiting, and chills. And moving on to the chief complaint of the patient, as I've already said, the patient Mr. Bir Bahadur Rai had chief complaint of the pain in the abdomen area, shoulder, radiating to the shoulder, fever, chills, nausea, vomiting. Now going to the medical history, he does not have any medical conditions like diabetes and hypertension, but he has a past history of chickenpox in his childhood. And going to the past surgical history, he has not have a history of hospitalization and he has not undergone any blood transfusion. And going to the present illness, Mr. Bir Bahadur Rai, as my patient, was admitted in multi-speciality hospital with the chief complaint of radiating pain in the stomach, in the shoulder, fever, nausea, vomiting, anorexia. And he was first admitted in the emergency room in 10 October 2019. Then after going through investigation, he was been diagnosed as cholelithiasis. So he was referred to the male surgical ward and Then he was moving on to the family history. The member of the family has six. There are 6 members of family, and the only member of the family is 3. He himself, his elder son, and the younger son. His wife, I've already his name is Bir Bahadur Rai, as I've already said, 42 years old, and he has a habit of smoking, drinking alcohol, and chewing tobacco. His wife name is Sunita Rai, and she's 40 years old. She does not have any habit of drinking, smoking, or chewing tobacco. His elder son, Amit Rai, who is 28 years old and drinks occasionally, and Mr. Bir Bahadur Rai, daughter-in-law, whose name is Sunita Rai. She is 26 years old and she does not have any habit of drinking alcohol, and their grandson, whose name is Vinod Rai, and he's 5 months old. And then the youngest son, whose name is Anmol Rai, he is 24 years old and he works as a local taxi driver, and he does not have any habit of drinking or chewing tobacco. Now going to the hereditary disease of the family, they does not have any hereditary disease like diabetes and hypertension. The total income of the family member is approximately 20,000. Now going to the socio-economic factors, the Mr. Bir Bahadur Rai has a good cooperation with his family relatives and neighborhood. They help each other in the times of crisis, and the economic income is approximately 20,000. And going to the environmental factor, Mr. Bir Bahadur Rai, their house has a proper ventilation facility, proper water facility, proper light facility, proper source of electricity. Then they have a good drainage system. And going to the physical examination, the abnormal findings were the tenderness while palpating in the abdomen area, right side of the abdomen area, and the abnormal distension. That was the abnormal finding to the physical examination. And Now going to the disease condition, cholelithiasis. Before starting the cholelithiasis, I would like to talk about the gallbladder, because gallbladder is associated with cholelithiasis. And I would like to talk about the anatomy of the gallbladder. First of all, a gallbladder is a pear-shaped gland, as you have seen here. This is the liver. This is the liver. This is a gallbladder. This is a cystic duct. This is pancreas, stomach, and small intestine, duodenum. And this is a normal individual's gallbladder and their organs. This is the abnormal. This is the abnormal, which we see in cholelithiasis. This is an abnormal formation of stone in the gallbladder. Now, I would like to talk about the disease condition cholelithiasis. Cholelithiasis, as I have already said, the cholelithiasis is the calculi or gallbladder stone disease or GI disease, because it is associated with the formation of the gallstone in the gallbladder, and it is this gallstone is due to the cause of excess production of cholesterol, bilirubin, that leads to the formation of gallstone. Now, moving on to the types of gallstone. There are two types of gallstone, that is cholesterol gallstone and pigment gallstone. Cholesterol gallstones is normally liver excretes cholesterol on the basis of the bile juice, but whenever due to some condition, whenever there is an abnormal excretion of the cholesterol, then this cholesterol forms into the crystal form, then eventually to the stone formation. That stone formation is known as cholesterol stone. And moving on to that, another type of stone, that is pigment stone. Pigment stone is usually due to the lots of formations of bilirubin. That's why it is known to be as pigment stone. Now, the clinical manifestation of the gallbladder stone is or cholelithiasis is the radiating pain in the stomach, or radiating pain in the breastbone, below the breastbone or hypochondric region, and the nausea, vomiting, fever, chills, anorexia. Sometimes there would be in the form of dark urine and light poop, light color or clay colored poop, that is stool. It is due to because this dark urine is due to because the bilirubin is not absorbed, and bilirubin is not absorbed in our body, and it gets eliminated with the water and with the urine, so it looks like a dark urine. And the stool looks like clay shaped or pale, because because this is the condition that cystic duct, the gallstone is blocked. That's why the stool looks pale and clay colored. And moving on to the causes. Now, causes, it is due to the cholesterol. Whenever the cholesterol, as I've already said, the liver excretes the cholesterol depending upon the bile juice. It's because the function of the gallbladder is to store the bile juice and to excrete its bile juice to absorb and helps in digestion of the food. And that's why when there will be the abnormal in the liver, abnormal eruption, formation of cholesterol that is excreted into the gallbladder, then there will be the excessive formation of cholesterol, can lead to the, as I've already said, cholesterol stone, and also the pigment stone, the same goes here, that bilirubin is formed after the body gives red blood cells, and it can leads to the excess amount of bilirubin. Then it is termed to be as pigment stone. Now going on to the risk factors. The risk factors of this gallstone or cholelithiasis would be being female, being pregnant, being obese or overweight, being obese or being overweight, having high cholesterol diet, having high fat diet, taking low calorie diet, having diabetes, having blood disorders like sickle cell anemia, leukocyemia, having liver disease, then having an contraceptive pills or hormonal therapy. And then this would be the risk factors for these are the people that are risk factors for risk to the patient. Risk to the patient. Now I would like to talk about the nursing medical management. Going to the medical management, this too is the medical management. This too is given to the patient who has a stone less than 5 millimeter. Then because this medicine can dissolve that stone, and this urosodil can help in dissolving the stone. And this antibiotic therapy like ciprofloxacin is given to treat the infection that can be present in our body. And this another way, if our stone is bigger and it cannot be removed by any medical therapy, then this laparoscopic cholecystectomy is used. Laparoscopic cholecystectomy, how can we use them? Then the specialist doctor can use a tube with the dye and the camera, then cut our belly, stomach by locating, and cut with the instrument, and remove the gallbladder. So this is known as an laparoscopic cholecystectomy. And open cholecystectomy is another type of removal of the gallbladder, where we cut our belly directly and remove the gallbladder. Now another is cholecystectomy. This is the removal of the gallstone, not the gallbladder. Now going to the nursing management. First, going to the nursing assessment, we assess the integumentary system, that is our skin, and the mucous membrane. We assess the skin, whether the skin is dry, hydrated, or there is turgor present, and we assess the GI system, whether the stomach is tender or abdominal distension, or the patient is reluctant to move. We will assess by this technique. And we also assess if there is the surgical procedure. If any procedure is done, then we have to check the site of the infection, in the site of the infection where the procedure has been done, and the site of the has been done. Then going to the nursing diagnosis of the patient. Diagnosis of the patient. First is acute pain related to inflammatory process. The goal is to eliminate the pain and give the comfort to the patient. The planning is to assess the level of the pain to give comfort to the patient, and by implementation we assess the pain score of the patient by pain scale, that is either be 8 out of 10. And we have to place the patient in a comfortable position and advise the patient to have some relaxation therapy and use some comfort devices. And going to the another diagnosis, nursing diagnosis, that is risk of deficient fluid volume related to disease condition, as evidenced by patient's integumentary assessment, that is dryness in the skin. First, the goal is to maintain the electrolyte and fluid and electrolyte balance. Now the planning is to assess the patient's fluid and electrolyte intake, to monitor the patient's INO, that is input and output. Now going to the implementation of this nursing diagnosis. We usually monitor the input and output. We advise the patient to reduce the intake of water, and we administer fluid and medication, especially the metronidazole to the patient, because metronidazole is also an antibiotic and also can help in maintaining the fluid and electrolyte. Now the goal would be the patient will improve at some extent. Patient will have a maintained fluid and electrolyte, and the input and output chart will be improved. Now going to the another nursing diagnosis, that is risk of infection related to the complication of the disease. The goal is to reduce the inflammation, or to reduce the pain of the patient. Now, and going to the planning. We have to assess the patient in having some. We have to assess the patient. Then going to the nursing intervention, we have to assess the patient in. We have to assess the location of the patient's site of the operation. We have to we have to do regular dressing with no risk of infection, with the sterile dressing. Proper hand washing technique should be followed with no risk of infection. And And another nursing diagnosis is imbalanced nutrition less than body requirement related to disease condition, as evidenced by the frequent refusal to take food. What we do in this nursing planning is to assess the nutritional status of the patient, to encourage the patient to take food, to go for the dietitian to plan the diet. And going to the nursing intervention, we encourage the patient to take meal, and we encourage the family members to prepare the meal depending upon the likes and dislikes of the patient, and we advise them to follow the rule of the dietitian that has planned for the patient. And the evaluation will be that the patient's nutrition status will be improved. Now then, going to the another nursing diagnosis, that is deficient knowledge related to disease process, as evidenced by frequent questioning. As evidenced by frequent questioning. Then going to the nursing planning, we have to teach the patient about the disease condition, its signs and symptoms, its management. Then going to the implementation, we have to implement that. We have to educate the patient about the disease condition, what's cholelithiasis, what can cause the cholelithiasis, what habit can create the gallstones, that like sedentary lifestyle and having high fat diet, low calorie intake, high cholesterol intake, and having diabetes can, and especially to change the lifestyle that the patient is having, like drinking alcohol and smoking should be avoided. And we have to encourage the patient to come for follow-up. Then the evaluation will be that the patient will get the knowledge about the disease condition, how it can be improved, how it can be prevented. Then the patient will be able to know his condition. And going to the health education of the patient, what the role of nurse can do is to educate the patient. As I already said, the role of education is to educate the disease condition, to avoid the sedentary life that the patient is going through, like having high fat diet, high calorie, high cholesterol diet, and we have to encourage the patient to have high calorie intake, like fruits, vegetables, and whole grains. And we have to encourage the patient. We have to advise the patient to avoid drinking and smoking, as I already said. And the patient should come for follow-up, and regularly come for follow. Whenever he comes to follow up, then there should be the ultrasound, regular checkup, like ultrasound and ultrasound, ERCP, MRCP, and blood test. And so this is the end of my case presentation. Thank you, ma'am, for this presentation, and I hope this presentation was very presentable for you. Thank you.